On behalf of myself, Lisa, Dr. Waters' nurse, I'd like to welcome you to the last stop of Dr. Waters' 2017 tour. In today's presentation, you will learn how the food we eat and many environmental factors affect our health in a very negative way. These factors are also the cause of the vast majority of diseases and death. But Dr. Waters will educate you today on changes you can make to reverse these diseases by simply altering your diet, incorporating exercise, rebalancing body systems and chemistry, your glandular function, detoxifying with sauna and chelation. You can correct your underlying health problems. Dr. Waters is passionate about showing us how to avoid diabetes, heart disease, and disability, thus keeping you healthy, happy, and out of the nursing home. Our presentation today, Prediabetes Epidemic, will allow you to ask questions at the end of Dr. Waters. So there's some handouts we gave you. Please jot down those questions and save them for the end. And without further delay, let's give Dr. Waters a warm welcome.
The problem with this prediabetes is that it's all too common. It's said that 50% of us are now pre-diabetic or diabetic in the United States. And that's rather interesting because the Hopi Indians in 1930 only experienced about 0% diabetes, and at this point they're at 90%. So you can well imagine that we were also about 0% in 1930, and now we're approaching 50%, so this is a serious problem. And it's not just about being tired and overweight. That's just an indication of serious underlying metabolic problems that are really underpinning this disease. We want more energy, but how do we get it? And we're going to learn that it's about food and environment and sleep and other lifestyle factors. If we don't correct this problem, we're liable to wind up with some of the things on the right there: strokes, heart attacks, blindness, amputation. Diabetes is a leading cause of blindness and of renal failure requiring dialysis. We are told by various people what we should eat, and it can get rather confusing because they keep changing the story. And you've heard even some companies trade on the stock exchange like Jenny Craig to promote their food. But so what is the answer? Is it Weight Watchers? Is it vegetarian? Is it paleo? And who should we trust? The AMA, the American Diabetes Association, the federal government, dietitians, or our ancestors? And we're going to get into that. My thesis is, if you've heard it from one of the authorities like the television, the federal government, a chemical company, or any division of the American Medical Association, you should probably run the other way, and we're going to learn why. Back in the 60s and 70s, a man named Ansel Keys at the University of Minnesota taught that the real problem of heart disease was fat, and that we need to get rid of the fat in our diet, and that will prevent heart disease. And at that time, people like the American Heart Association picked up this idea and started promoting, quote, healthy whole grains. And they actually would get money to put that on labels from different cereal grain companies. During the time, you might remember about 10 years ago, there was a bunch of talk about high fructose corn syrup and how it was really causing a lot of health problems. And at that time, the sugar industry got worried about the what they considered negative publicity, and it was. And we doctors all received this very fancy document, and it basically stated that this is just not a problem at all, and that sugar should be part of our diet. And it was actually endorsed by none other than the American Medical Association, the American Dietetic Association, and your Food and Drug Administration. So clearly, the industry had on their side the powers that be, which is why I say don't listen. And to bring this home even more, this is an actual ad from the Journal of the American Medical Association. They made hundreds of millions of dollars selling cigarettes. And when finally it came out that cigarettes caused lung cancer and other diseases, they switched over to selling drugs, and that's what they're doing today. Sugar even became promoted as a health food. Here from the 1970s, sugar can be the willpower you need to undereat. Can you imagine that? And sugar's quick energy can be the willpower you need to eat less. And then the worm turned. Not too long ago, and it's been happening over the last few years, the idea of fat being dangerous has fallen apart. It was never true. Real scientists knew this back in the 70s when all this nonsense started, but nevertheless, finally, the truth is coming out. And then, and this is why I say don't believe magazines, this Ansel Keys was featured in Time magazine back then, and now the same very journal says to eat butter. So I think that says it all. Now, if we want to know what to eat, we should ask, where does the evidence come from? If I tell you what to eat, I should have some rationale for it. And we have other lectures on anthropology, and the first item there, stomach contents preserved in bog bodies. You could actually tell what people died from, or what they ate, and what they died from about 1,000 to 2,000 years ago. There's also archaeological data that accumulates, historical documents like Tacitus's Germania, and analysis of modern cultures, hunter-gatherer cultures, which we'll go into. The doctors that have looked at Paleolithic nutrition, trying to reconstruct what our ancestors ate, have come up with this type of food pyramid based mostly on wild game and seafood in areas where there was such, and then various gathered items, vegetables, nuts, seeds, and fruits and berries in season. A man named Eaton, he and his wife and others spent a lot of time, and they're still researching this, and he gave a summary of why the Paleolithic diet was a better diet. One was that there were almost no refined carbohydrates in diets in those days, that there was a tremendous amount of fiber from fruits, roots, legumes, nuts, and other naturally occurring non-cereal grain plant foods, and that these people had to work to get their food. As a matter of fact, if you would summarize why we're so sick, you could get it from the Eatons. The differences between the Paleolithic diet and our modern diet is they ate no refined carbohydrates, they ate a high fiber diet, and their foraging lifestyle required vigorous exertion. We forage mostly in our refrigerators and grocery store aisles today, and some of us actually use little carts to haul ourselves around. You've seen that. We can look in more detail at what was actually in these diets. And I direct your attention to zinc on the second to the last here. It's estimated that paleo diets had approximately 43 milligrams of zinc. Our government says we need 12 to 15, but the average American gets 5 to 14. So most of us don't even get enough zinc in our diet. And fiber is even more serious problem. We estimate 50 to 100 grams of fiber was consumed back then. Our government says 25 to 35, and people are lucky to get 10. That alone can make you very ill, as we'll learn about our microbiome. And most importantly, too, with regard to metabolic syndrome, magnesium, we're getting about 1/3 of the magnesium as our ancestors. And when we look at where we get our animal food, if you look at the omega-3 fatty acids, these very important long-chain fatty acids, if you look at grain-fed beef, about 0.4% of the fatty acids are omega-3. Grass-fed, it goes up to 2.8, and in wild venison, we're talking 4.8%. So it matters a lot where you get your meat. And I would encourage everybody to only use fodder-fed, organically raised animals for their food. So we constructed a food pyramid for our clinic to kind of teach what the basis is. And we believe in this time we should have a plant-based diet supplemented with various animal foods, with fruit in season, and sparingly use cereal grains, oils, and certainly not use refined sugar except maybe a little honey and maple syrup. This food pyramid is based on abundant use of colorful pigmented vegetables, roots, fruits, and other natural occurring plant foods. Fats were not considered toxic in prior times. As a matter of fact, the candlefish produced for Native Americans here in Wisconsin and around this country, Eulachon oil, and this was traded as money. Actually, oil packed into like gopher intestines. And these roads that Native peoples traveled on became known as grease trails because there was so much oil left. And finally, fruits and sweets were consumed seasonally and sparingly from natural sources. So we ate as much fruit as we could in the fall, and then we put on a few pounds, and then we didn't have any more fruit except maybe a little bit of dried fruit. And that's a big difference. Now we have 365 days a year of all the fruit, all the sugar, etc., that we wish. The next thing we're going to talk about is a dentist named Weston Price. Anybody heard of him? Good. Dr. Price operated in Ohio, and he wondered through his career why Americans had such rotten, crooked teeth. And he and his wife decided to go on a world tour. They went to every place from Pacific Islands to New Guinea to northern Canada to the Hebrides Islands in Scotland, and even in a little town in Switzerland was locked in a valley where there was no communication or trade in or out of this valley. And he went and examined the teeth of many thousands of individuals around the world and recorded very carefully what he found and what they ate. And native peoples eating traditional foods had physical excellence, splendid facial and dental arches, and no cavities. And here's an example on the left of an ancestral diet. And then the processed food came into their cultures, and you could see what happened to this poor girl's teeth. And actually, it gets a lot worse. And the stories that you could read about what happened to these native peoples, of course, they didn't have dentists. They didn't need dentists. And when they had this kind of dental decay, if anyone in this room has had a toothache, you know what it's like. And people committed suicide from this pain. Here you could see the crowding and the loss of development of the midface. That's one of the reasons why a lot of us have trouble breathing at night, because of the lack of development. Dr. Price worked all that out. And I think this picture really tells you something. Look at the native peoples on the right, the happy people in the woods, and then look at this store. There it is, confections, tobacco, ice cream, canned goods. And here we are today. Science has not been silent about these dental problems. This come from a science journal a few years back, and they noted that why are our teeth so rotten? Biologists point to a mismatch between our diets and lifestyles and those of our ancestors. After sugar came to Europe, first to the upper classes and then gradually to everyone, this was the result. Now, you might say, well, that was native peoples. What about what we ate when we were still in Europe, most of us? And in fact, we ate all the same animals. We used bows and arrows. We gathered various plants, roots, and yes, we did a little gardening as the native people here in Wisconsin did, but our diet was very similar. As a matter of fact, what Dr. Price showed around the world is that people in native cultures ate real food, unprocessed food, and they had robust health until the white man brought our culture and our food. Another interesting area is comparing more recent times, not ancient times, but the Victorian age. And these researchers, Paul Clayton, who is a medical doctor, and Judith Rothbotham, who is a Victorian historian, looked at autopsy data from many people dying in England. In those days, in the 1880s, everyone got an autopsy. We used to try to get families to let us do autopsies on everybody, but that's kind of died out. And now people say, well, we had a CAT scan, we know what they died from. But you learn a lot from autopsies, and you learn all the mistakes that we doctors make. Well, anyway, these two compiled death data, and these were very carefully done autopsies, very carefully recorded. What they found in 1880, the rate of cancer in black there, the rate of cancer at death was about 2%. And what it is today is at least 10 times that. Now that alone should give us pause to explain how could that happen? 2% to 27%? Heart disease went way up. The yellow, infections and parasitic diseases went down. So we basically traded TB and infections and bad water for the modern diseases that we're talking about today. And by the way, I would challenge anybody here to find 6 Wisconsin tradesmen like these 6 with this type of physique. And here up on the upper right, you could see one of these young men carrying a whole pallet of bricks that he made that day compared to a modern tradesman. And of course, to get their food, our ancestors had to work. Remember, native peoples here didn't have horses until about 500 years ago. Thousands of years before that, they hunted buffalo on foot. One of the things the medical profession tells us is that things like autism used to be just as common as they are now, but we weren't good at diagnosing it, and now we're so much better. And that cancer must have been just as bad in the old days, but the doctors just couldn't figure it out. Well, here's an example of the difference in the percent of obesity in 1892 and 2000, and it's gotten worse since then. Through the decades of life, on the left, you could see by age 50, less than 5% of people were obese. By 59, even fewer. And by 70, even fewer. And when you look on the right, you could see that even by age 49, 20-some% of people are obese, and it just gets worse. So things have changed. Diseases have changed. Now, this factor of increasing heart disease, diabetes, et cetera, has also been documented by very famous doctors. One of them is Sir William Osler. He's actually considered the founder of internal medicine. And he first proposed the cause of heart disease to be infection in 1908. He described chest pain due to heart disease as a rare disease. And now it's like 1/3 of us die from some kind of cardiovascular disease. Paul Dudley White, who was President Eisenhower's doctor, graduated med school in 1914 and saw only 2 cases of coronary artery disease in training. He stated that, quote, until the first 2 to 3 decades of the 20th century, coronary heart disease was rare, and look at this, not missed by ignorance. He's making it clear that it wasn't there. And it started in the 20s and 30s, and you'll see this is when food processing became more common, chemical additives, and the beginning of the whole chemical toxic farm industry. And finally, a man named James Herrick, who was listed in the AMA as one of the founders of cardiology, he first described heart disease resulting from hardening the arteries in 1912. So all of this is on the same time scale. About 100 years ago, all this stuff takes off. So then, as I said before, the story changes. And now it's said in scientific journals that saturated fat does not clog the arteries. Coronary heart disease is a chronic inflammatory condition, the risk of which can only be effectively reduced from healthy lifestyle interventions. So the cat's out of the bag. It's not fat, although you'd be surprised how many doctors are still telling people you better have a low cholesterol diet. They don't even read Time magazine, I guess. At any rate, here's the advice before the 60s, before this nonsense about fat came into play. This is from a textbook of endocrinology by Raymond Green, 1951. Foods to be avoided: bread and anything else made with flour, cereals, potatoes, and any other white vegetables, foods containing much sugar. You can eat as much as you like of the following food: meat, fish, birds, green vegetables, eggs, cheese, fruit, except bananas and grapes, because they're so high in sugar. Now, this is for diabetic patients. That was the story. And then came drugs and insulin, and now doctors actually say, just give yourself more insulin if your sugar's too high. Go ahead and eat bread. You can have dessert, and you wind up on more and more insulin, which we're going to learn about later is really the culprit. Insulin's the culprit. And just to show you the annual consumption of sugar, starting in 1700, about 2 kilograms, less than 5 pounds a year, goes up to 10 kilograms, 40, and more recently 80 kilograms. So we're eating something like just under 200 pounds of sugar per capita, some more than others. Of course, those big gulps that they sell you at the gas station, a lot of sugar. You can get, 50 teaspoons of sugar in a short period of time. And the next one shows a different graph of the increased sugar with the little open dots, and then the small graph to the extreme right with the dark dots shows the rate of obesity. So, you hear from the industry, well, sugar doesn't cause obesity, but, just look at the graph. And another problem with sugar is it doesn't get us satisfied. Glucose does, to some degree, attenuate a hormone that makes us want to eat, and fructose does just the opposite. So it basically makes us want to eat more, and it doesn't satisfy our hunger. So this is why it's gotten a bad name, and rightly so. Now, we're not going to go into all this, but these slides will be on the website at some point soon. And this is just some of the chemistry of what happens when we ingest a lot of fructose. It has diverse effects on our chemistry, and that leads to inflammatory molecule production, brain degeneration, heart disease, endotoxins. We get the wrong germs in our gut, which we'll get into, and then germ fragments get into our bloodstream and cause inflammation in our whole body. Another major change in our life has been eating out. I'm told that about 2/3 of the meals are not cooked at home now. And I can tell you, when I was a kid, 95% of our meals were cooked at home, and we brought our lunch to school. So that's a huge change. And these large corporations have taken control of a lot of our food supply at many levels, and their budgets allow great influence. Huge advertising and public relation budgets have funded what they call scientific research to prove that their products aren't dangerous. And believe it or not, the American Heart Association early funding came primarily from Procter & Gamble promoting Crisco. Who remembers Crisco in this room? Can you believe that people actually ate that stuff? It'd be like for axle grease or something. And who remembers when they developed margarine and they had a little ball of dye that you had to mix with this god-awful white stuff and stir it up? And they got people to do that and made them believe that butter was bad for them and this stuff was good. Now, right there, that should tell you they can get you to believe a lot of crap, huh? And so the buyer beware. So really what's happened is this. We've changed to food-like substances from real food, and it's caused a rapid degeneration of our health, just as it did our native ancestors. And they even now dye your food to make it look like real food, because your brain knows what these colors mean. Animals know that red has certain meanings and purple, and they've even gone that far. And by the way, there's a wonderful book called The Dorito Effect that talks about how they flavor our food. 2,000 chemicals are used to duplicate the flavors that were actually in our food originally. That's another whole story. So many different things are added to food. Besides having too much refined food, a myriad of substances are added. So, they say if you can't read what's on a food package, if you don't know what some of those things are, you shouldn't buy it. To summarize at this point, the real problem is that we've been eating a refined carbohydrate diet, and we've had much less physical activity. The diet has resulted in deficiencies of various minerals, fatty acids. We have too much iron in our food. The government made the industry took out all the minerals from the food, from the grain, but then it made them add back iron, which is exactly what we don't need in adult life. Lack of pigments, the things we talked about earlier and we'll talk more about later, the different colored plant items that help our health, the diminishment of fiber, toxic metal accumulation, and endocrine disruption, which means the chemicals, farm chemicals and plasticizers and whatnot that alter our gland function. This is a commercial message.
For over 125 years, we've been bringing people together. Today, we'd like to come together on something that concerns all of us: obesity. The long-term health of our families and the country are at stake, and as the nation's leading beverage company, we have played an important role. Across our portfolio of over 650 beverages, we now offer 180 low and no-calorie choices. These diet beverages still pose serious health risks. Even though we've reduced the calories per serving, these beverages can still cause kidney problems, obesity, metabolic syndrome, cell damage, and rotting teeth, which leaves 470 beverages which have extremely high, unhealthy levels of calories. Consuming large amounts of rapidly digested sugar and high fructose corn syrup causes a spike in blood sugar and insulin, which can lead to inflammation and insulin resistance, both of which may increase your risk of stroke, heart disease, diabetes, obesity, and cancer. Coke has also been known to accelerate aging and cause high cholesterol. The American Heart Association recommends consuming no more than 450 calories from sugar-sweetened beverages per week, the amount in about 3 cans of soda. Imagine if cigarette companies said they were doing something responsible to protect you. How would you react to that? Beating obesity will take action by all of us, based on one simple, common-sense fact. All calories are not the same, and the calories in Coca-Cola products have no nutritional value. If you choose to live a healthy lifestyle, then you should not be drinking any of our products. If you drink Coke, you'll get fatter and fatter. The solution is simple, and it's right in front of your eyes. Don't drink Coke. It's killing you and your family. Coca-Cola. We're partially responsible for America's obesity problem.
I wonder why Coke won't sue these people. Can you imagine? It's called discovery. Would you like to go into the courtroom and defend poison liquid that's killing people? They won't sue. These people wish they would sue. But anyway, people are addicted to this stuff, though, let's face it. And if you did one thing, quit using all forms of sugar, that alone would improve your health immeasurably. So we're going to recap. We do know whom to trust. It certainly isn't the government or advertisers. Our diets are very different than our ancestors, and an increase in this processed food and sugar consumption has led to obesity and heart disease stemming from what we're going to spend some time on now, insulin resistance. Who has heard of insulin resistance, by the way? Okay, about half. And this insulin resistance leads to prediabetes, which leads to diabetes, which leads to all these complications of strokes, heart disease, having to have kidney dialysis, blindness, amputations, dementia, and eventually the nursing home. And we are not doomed. We're going to talk about what we could do about this, but first we're going to talk about a phenomenon called Syndrome X and insulin resistance syndrome. When I graduated medical school in 1976, I had never heard of insulin resistance. Cholesterol was sort of on the map, but I was a surgical intern and resident, so we didn't talk about diet at all. As a matter of fact, doctors got almost no dietary training whatsoever, still don't get much. At any rate, in 1985, during a chelation meeting, a man named Gerald Raven gave a lecture. And Dr. Raven had gotten interested in diabetes back in 1960 when he learned from other researchers that people with what they called then maturity onset diabetes actually had elevated insulin, as opposed to the type 1 people that have no insulin. It's a totally different disease. He also knew from other researchers that triglycerides were just as important as cholesterol in the causation of heart disease. And so during his research, he developed something called an insulin clamp technique. In this testing, he would start an IV and infuse insulin into the patient's veins and to try to keep their sugar steady. And he found that some folks needed an excessive amount of insulin in their IV to keep their sugar, say, at 85. And this was the beginning of understanding that a person could make too much insulin, but the insulin isn't working because their cells are resistant to insulin. There was another group, Ahrens and Farquhar, showed that triglyceride elevations were not caused by eating fat. Now remember, this is mid-1960s. There is no excuse for this fraud to have gone on for 50 years. Triglycerides are caused by eating carbohydrates, not by eating fats. In 1967, Dr. Ravens showed that people that had this insulin resistance, that their pancreas was pumping out more and more insulin to try to control their blood sugar, and then the insulin was directing the sugar to be formed into triglyceride fats and LDL cholesterol, which we all know doctors are trying to lower. They're trying to give you drugs to lower it when in fact all you have to do is change your diet and it'll lower on its own. Then, and this is really outstanding fact, in '83 he showed that when he gave normal people a 60% carbohydrate diet, they made excessive amounts of insulin, their triglycerides went up, and their HDL went down. And get this, I just looked this morning on what our government and the AMA and et al. Are saying should be the ratio of carbs to fat to protein. At least 55% of your calories should be carbohydrates. I mean, this is still their recommendation. So they're turning everybody into a person with potentially high triglycerides. And some of us have more tendency than others. Some of us are lucky and can eat a lot of carbohydrates and don't have this problem. He then spent the next 20 years making the relationship solid between the ingestion of carbohydrates, the secretion of insulin, the elevation of triglycerides, the reduction of HDL, and the diseases that manifest from it: heart disease, retinal disease, kidney disease, circulatory disease to the lower extremities, and high blood pressure. This became all tied together, and he even showed that if a person has high blood pressure and you give them drugs to lower their blood pressure, lo and behold, when you use the insulin clamp, they still have insulin resistance. All you've done is bludgeon down their blood pressure with drugs. You've done nothing to solve their real problem. The disease marches on. Well, he did this work over a 25-year period and was criticized all the way by the so-called leaders in the fields of endocrinology and metabolism, but he persevered and finally in 1988 received the Banting Prize for his work, and during that acceptance speech he described Syndrome X. And Banting, by the way, is the guy that discovered insulin, so the society that honors Dr. Banting actually gave this prize to Raven. You don't have to have much in the way of lab tests to find out if you have metabolic syndrome. There's 5 primary things one can look at. The first you could do with a tape, and that means if you're over 40 inches around the middle in men and 35 in women, you have one of the components. You only need 3. Triglycerides over 150, HDL less than 40 in men and less than 50 in women, and even slightly high blood pressure and even sugar at 100 or more. We actually measure insulin and something called A1C, so we can really tell if you have this. The point is, that's why half of us have it. It's real easy to get diagnosed with insulin resistance. This just reiterates that I'm not kidding about the number of us that have diabetes. This is in California. Look at the age group 55 to 69. 60% of people have either prediabetes or diabetes. There's a difference in the way our body metabolizes starch and sugars, proteins, and fats. With carbohydrates, we secrete, they go up in the blood, and here's really the center of this. When you ingest carbohydrates, they're absorbed into your bloodstream, and they go to your pancreas, and your pancreas has little cells called beta cells, and they make insulin in order to send the sugar inside the cells to be burned for energy. When we eat protein, much less insulin is secreted, and when we eat fat, none is. So when we eat carbohydrates, we make a lot of insulin, and then the sugar drops, and then we're hungry again. Do you know that feeling? That's where Jay's potato chips, can't stop eating them and all that stuff. It's all true. The more carbohydrates you eat, the more you want. And the difference is in how these different types of macronutrients are metabolized. And furthermore, the weight that we gain around the middle, if you could look inside your body, you would see that your organs are infiltrated with this fat, and that fat makes things called cytokines, which are inflammatory compounds, which are really the basis of all the misery that you suffer from prediabetes and diabetes. So there is no such thing as borderline diabetes. It's a progressive loss of control of blood sugar, because eventually those beta cells in the pancreas cannot keep up with the sugar that's coming into the blood, and they keep making more insulin, more insulin. We're going to learn that insulin is really the culprit. So what are some of the historical features of this insulin resistance? Chronic fatigue, weight gain, yeast infections, waking up in the middle of the night needing a snack, feel exhausted in the morning, and frequently on drugs for their lipids, drugs for blood pressure, and antidepressants because you don't feel well. And you go to the doctor and they start piling drugs on. They never say, what are you eating? Or rarely, how many people have been to a doctor and they asked, what are you eating? Nobody? You have, well, because you come to me. But I mean, it's just uncanny. You know, you would think, if you go to a farm and ask, you know, how do you take care of your animals? I mean, what animals eat is the most important thing a farmer has to know to stay in business, huh? And some of the historical features in women is they start gaining weight. Of course, especially my mother said that I was the cause of her weight problem, that she weighed 120, and after she had me, she gained 60, and it went up from there. And that's sort of true. Women have been cursed sort of with, it's much easier for them to gain weight and harder to lose. You know, the man and wife will go on this low-carb diet, and the guy will drop 25 pounds, and the woman will drop 4. It's just not fair. But anyway, women get other things like gallbladder trouble, gestational diabetes, getting whiskers, can't lose weight after the baby after I saw, and all kinds like PMS and blood clots and whatnot during their periods, lots of menstrual irregularities. And in men, you see loss of libido, loss of strength, of course, belly fat, and just not feeling well and irritable. And you can also find physical things. Look sometime to see if you have any skin tags. These are caused by insulin. And when you go on a low-carb diet, people tell me this all the time, these things fall off. You don't have to go to the plastic surgeon. Change your diet and they fall off. Sleep apnea, even in slender people, is associated with insulin resistance. And so here are the behaviors, and we've already talked about some of these. The standard American diet, of course, is first, but physical inactivity, lack of sleep, yes. Even having poor sleep contributes to this metabolic problem. Stress, which I guess most of us have, and we're learning that electromagnetic pollution from cell phones, cell towers, and other sources, we've never had that before the last 100 years either, did we? So there's a lot of new things that our bodies have not adapted to. So while not only does sugar make you make more insulin, which we're going to learn has its own effects, but sugar itself, when it's high, starts to stick onto your proteins. We call it glycosylation. And it alters the proteins and creates things called advanced glycosylation end products. They get altered more and become reactive end products, and they become the ultimate inflammatory, destructive substances that underlie, again, arteriosclerosis, kidney failure, eye disease, nerve disease, and dementia. So this means that the person is not turning their glucose into energy, but instead is turning it into fat, and the non-used sugar is attaching to proteins, causing malfunction of these proteins, leading to disease. So it's a distortion of all these proteins in our body. Now, our body's forgiving, but little by little, this takes its toll, and you start to slow down, you get forgetful, you can't move as quickly, etc. And so next we're going to talk about getting down to the nitty-gritty, and that's this structure here, the endothelium of your tiny vessels. All this inflammation that occurs as a result of insulin resistance and this glycation of proteins and the liver filling up with fat, because that's what happens. We're seeing pre-cirrhosis in children that never drank a drop of alcohol. Sugar does every bit as much damage to the liver as alcohol. Slower, but it does do it. And that liver then pumps out all kinds of inflammatory substances which alter the function of the tiny blood vessels, the inner lining called the endothelium. That's where the tire hits the road. Those little vessels get smaller and smaller and actually deliver the nutrients and oxygen to every cell of our body and take away the waste products. And as a result of this, there's a tremendous overlap between type 2 metabolic syndrome and dementia. Because the brain uses 20% of the cardiac output. It doesn't seem like it's that active of an organ in most people, does it? But I mean, even in oneself. But realize that this thing is working 24/7. It knows where your body is at night. You can hear at night, or otherwise animals could get you and you wouldn't know it. So that brain uses 20% of the calories. And by the way, the brain needs insulin, and we're going to learn about the new type 3 diabetes you might have heard about. And it's been described as the real cause of dementia, that the brain insulin receptors get totally blunted, and the brain can't bring sugar into its cells, and the cells die, and you wind up in a nursing home. Now, there's a way out of that. We're going to learn about a ketogenic diet in a little while, but there's a tremendous overlap between Alzheimer's disease and type 2. And it's even shown now, diabetes and Alzheimer's disease, two overlapping pathologies with the same background, oxidative stress. And real briefly, when you burn wood in your fireplace, you get ashes, right? When your car goes down the road, you get exhaust fumes. When you burn sugar and fat in your little engines that we're going to learn about, you make waste products. They're called free radicals. They cause damage to cells, to the proteins, to your very DNA. So these oxidative stress means that you have too many waste products compared to your ability to eliminate them or dampen them. And you know how you dampen them with vitamins, right? Vitamins like C and E and all that. and you also make antioxidant systems in your body. And indeed, brain atrophy is already evident in patients with prediabetes. Further analysis will also look at cognitive decline and the development of dementia in the group. We also intend to look at associations with other outcomes of cerebral dysfunction, including depression. So this, when a type 1 diabetic is discovered, they have no complications of diabetes. But when you discover somebody at age 50, they already have complications because Dr. Raven taught us they have been making too much insulin for decades, possibly even since childhood with the present dietary regime. And here's a little bit more complex article or diagram. See, high carb diet at the top, it accumulates in the liver, it makes you have a fatty liver, that's steatohepatitis. It causes you to have insulin resistance, and the fat in the liver make all these inflammatory cytokines, which then start to damage your brain and shrink your brain. Then you also have over here all the rest of your environment, the neurotoxic chemicals, heavy metals, too much iron in your body, which we're going to talk about. So here we go. They're finally coming around, fueling the Alzheimer's brain, upping cognition with fat. I got to meet a lady whose husband was ready for the nursing home. She was a medical doctor, and she couldn't let him at home anymore because they start starting fires and this kind of thing. And she read about coconut oil, and she started giving him a couple of ounces of coconut oil a day, and guess what? He didn't have to go to the nursing home. She published an article last year in which she added ketone bodies to his regimen, and now the man's able to read. Now, I'll tell you, the nursing home next door to my clinic costs $7,500 a month to stay there. And it's not the best nursing home in the world. How are we going to afford this? If half of us are on the road to this diabetic situation, a large percentage of them, if they live long enough, will start to need care. We got to do something about this. This insulin resistance idea, it isn't just about diabetes and heart disease. The large medical library called PubMed, I went and punched in insulin resistance and obesity, 39,000 articles, kidney disease, 4,000 articles, autism, even 22 papers, fatigue, 233. So this insulin resistance problem, high carb diet problem, it permeates all medical conditions because we're really talking about how we burn fuel and how we deal with the waste products. And when we have a high carb diet, it's very difficult to do that efficiently. Now, insulin has many other effects. I mean, its normal function is to sweep sugar into your cells to be burned. However, it also makes cells fatter. It actually makes you store more fat, and it actually inhibits you from breaking down fat, which is the worst of both worlds, right? It also causes what we call aldosterone effects, so it causes you to retain sodium and thereby drives your blood pressure up. Worse, it causes growth hormone, increase in growth hormone activity, which promotes cancer growth. And even the University of Wisconsin now is saying, oh yeah, there seems to be a connection between insulin and various cancers. You're starting to see cancers of the lung in women that have never smoked. And it's thought to be related to insulin. I got that from an oncologist down there. So the medical literature strongly supports the relationship between insulin resistance and fat levels in the blood, the increased production of these free radical waste products that damage all of our tissue, and more important, increased calcium inside the cells and dysfunction of the inner lining of the little vessels. Now, so far, we've talked about sugar causes us to make too much insulin, and the insulin now we can see has bad effects on a number of systems. Also, this process of inflammation in insulin causes the arteries that supply our cells, the little bitty ones, to malfunction. They become spastic and plaques eventually develop in them, okay? Now, remember, oxygen and food go from your gut and from your lungs through your bloodstream and are delivered through these little blood vessels, right? That's the normal way. But remember, that's just the beginning of the story. Those substances, including oxygen, must then cross into the cells, each and every cell, and then cross into a structure called a mitochondrion, which we're going to talk about momentarily. So in summary, this is kind of the two extremes, I'll admit. On that right side, ingestion of sugar and carbs, you have an appropriate amount of insulin release. It's transported in the cells through these little things called glucose transporters. It's burned efficiently for energy and heat, and you have health and happiness. On the other side, high carb diet, high insulin, you get resistant to insulin, and you have increased free radicals, low energy, damage to cell structures, inflammation, and the whole array of diseases we've been talking about. I'm sorry to keep saying this over and over again, but this is that simple. This is what makes you go to a nursing home or lose your vision. So what can we do now that we've talked about all this, the causation? And this man, Dale Bredesen, he's a neurologist he's now the first guy to actually show that a high-fat diet, along with other interventions like hormone administration, chelation therapy, and whatnot, actually reverses dementia in 9 out of 10 people in his study. And his diet told him, Dale, his wife, told him, you're doing all this fancy stuff in the laboratory, but I'm telling you, Dale, it's all about DESS, diet, exercise, stress, and sleep. And now Dr. Bredesen says, my wife's been right all along, but he had to prove it. But this is like common sense, actually, isn't it? So we're going to talk about the different diets that might reverse this. The first we've talked about, the Paleolithic diet, and next would be ketogenic, and then some details about plants, certain substances in plants. So the Paleolithic diet is the diet of Native Americans. It was our diet of people all over the world. It's based on not just avoiding processed foods, but also there's not much in the way of any kind of sugar in this diet. And there wasn't even dairy products. That's another whole controversy. And it's an individual thing as to who can use those. The ketogenic diet is a high-fat diet. And basically, we look upon it as a resetting. Imagine those insulin receptors, they can't read the insulin. And so the body makes more insulin and it does all these terrible things to us. And plus the sugar stays high anyway. And then it gums up your proteins and you have all these complications. With the ketogenic diet, you're taking out almost all carbohydrates, at least temporarily. And this allows these insulin receptors to be reset. I've actually had a patient once that was on 300 units of insulin and his sugar was still 300. And I said, why don't you try to go off insulin altogether and eat no carbohydrates? Indeed, his sugar came down. He didn't need insulin. I don't believe very many people need insulin. We sometimes have to find out whether you're still making insulin or whether your cells have got burned out, which is why it's so important for all of us to deal with this problem now so that we don't run the risk of losing all of our pancreatic secretion. And then briefly, the plant paradox. This has to do with certain substances in plants that cause animals to get sick. Antelopes can run away from a cheetah, but plants can't run away, so they make poisons. Extreme example is mushrooms, but lectins are a substance found in soybeans, cereal grain, solanaceous vegetables, and we're not all sensitive to it, but basically gluten is a lectin. And these lectins irritate the lining of our gut and make it leak so that substances can get in, circulate around the body, and cause inflammation. So in some cases, we help guide people onto a very low lectin diet. When people come to our office, our nurse and I help design with your lifestyle in mind what will work for you. Some people have to go to more extremes on this diet than others because they're already in trouble and may have very high sugar and even complications. And so they have to be more aggressive, but perhaps later on they could loosen this up because people did eat carbohydrates. I mean, the New Guineans live on sweet potato yams and they have robust health. And that brings us to a little more about the microbiome. So they're in high concentrations, as I said, in cereal grains, legumes, and the only nut that you have to avoid are cashews, but we get into that with you in the office. And now here's a good thing. So when we ate all these plants, we got a lot of other things besides calories and fiber. We got polyphenols, bioflavonoids, proanthocyanidins. And here's some of them you've heard of: berberine, curcumin, green tea, cinnamon, bergamot, pine bark extract, and yes, chocolate polyphenols. We recommend you get the highest percent chocolate and have some every day. It's medicine. You don't need a pill for that one. And things like frankincense and silymarin from milk thistle. All of these things talk to your cells and diminish this inflammation and improve the sensitivity of insulin. So that brings us to the gut, the microbiome. It's a digestive organ. It makes hundreds of compounds. We give them a home, they give us all kinds of wonderful things. Your flora is your friend. They help digest our food. They muscle out bad germs. The best way to not get an infection is to have good germs in your gut and sinuses and whatnot. They provide essential nutrients. They actually manufacture vitamin K. They manufacture Q10. Some of the B vitamins. They make amino acids. They train your immune system. And even now, again, 2017 American Medical Association, once in a while something gets in there, it is plausible that the human microbiome may affect the risk of obesity and type 2 diabetes and other diseases such as atherosclerosis, and that manipulations of the microbiome might reduce that risk. And that gets us to using probiotics, but most importantly, feeding these germs with fibers from plant material. So now, besides having a government and an industry sell us the idea of eating bad food and not eating healthy fats, we doctors have managed to really, I don't know of any profession that actually creates new business. We give people antibiotics. They damage your microbiome, and that sets you up for autoimmunity and whatnot. We give people non-steroidal anti-inflammatory agents which cause leaky gut, things like Motrin and Aleve. These things are bad news. Leaky gut means inflammation in your whole body. Doctors give people stomach acid blockers like Prilosec. These things, according to the label, you should only use them for a few weeks. I see people that are on them for 2 years, and they're associated with, guess what? Dementia, fractures. They cause you not to absorb minerals. Why do you think you were made with this vat of hydrochloric acid in the middle of your body? You need acid. The reason why people have reflux is because they're overweight and they eat too many carbohydrates. All that stuff goes away. And then artificial sweeteners. They actually make you gain weight because your body thinks you ate sugar and makes more insulin. And then you have endocrine disruptors. That's a whole lecture. That means that there's substances in our environment that look like hormones to your body, and they bind onto your hormone receptors and alter your hormone function. And that's everything from plasticizers to farm chemicals to heavy metals like cadmium. Now, speaking of organic pollutants, I ate a lot of sugar when I was a kid, a lot of sugar, and I paid for it dearly in my dental health. But I was like 150 pounds at 6 feet tall. And I ate anything I wanted. And yet today, it seems like obesity has increased dramatically, even with, there's been a tremendous increase in sugar, but still, it's uncanny how difficult it is to lose weight. And now it's been looked at about persistent organic pollutants. And they followed a bunch of people over a couple of decades, and they measured their blood sugar and insulin biology along with the level of different kind of chemicals in their bloodstream, and there was a direct relation. The more chemicals they accumulated, the worse their chance for diabetes. So it's not all our fault. There's a lot of wild cards in our environment. And then the last two are the genetically modified foods, which again could be a whole lecture, and exposure to blue light. You should have your bedroom pitch black. We should try to avoid light at night like we did for all the millennia before electricity was turned on. By the way, electricity was turned on about 100 years ago too. Interesting, isn't it? Processed food, chemicals, doctors pushing drugs, and electricity in almost every home. We're going to quickly go through the end of this. First of all, I told you that insulin and blood sugar were the issue. And insulin causes all this trouble, and sugar gums up your proteins, and all that's true. Then I said, yeah, but really what happens is that endothelium of the little bitty blood vessels gets impaired, and now you can't transfer all your nutrients and oxygen into your cells. That's all true. But then that oxygen and nutrient supply has to go into that cell, and then it has to go into a little guy called the mitochondrion, and that's where we burn our fuel. And that little guy on the right, and you see all those membranes, that's where the enzymes are that allow us to burn our fats and sugars. We take in oxygen and food through our lungs and GI tract, and our heart pumps it around, and then in the cell, There are many mitochondria, sometimes 10,000 of these little guys in a cell, in a very active cell like brain or heart, and in a cartilage cell, maybe 10, because it doesn't need to make much energy. But anyway, when people say, well, vitamin B1 is good for this and B6 for this, basically all of these B vitamins, all of the minerals you know of, and thyroid hormone, testosterone, et cetera, all work in the mitochondrion to operate the chemical pathways that you make, from which you make energy. And here's a close-up of the mitochondrion, and I just direct your attention to the top. Again, when we take in glucose, we make insulin, it increases fat stores, it blocks fat breakdown, triglycerides accumulate and start clogging up your arteries. If we get stuck in a high glucose diet, you see the glucose never makes it into this mitochondrial Krebs cycle, this really high efficient calorie burning. Instead, it gets converted to lactic acid, goes back to the liver and gets to be glucose again. So you get into this thing where you have to eat sugar every couple hours. You get it? You're stuck in the top right instead of getting into this highly efficient energy where you make a ton of energy in the presence of oxygen. And so here it is. Mitochondrial dysfunction and diabetes, from molecular mechanisms to functional significance and therapeutic opportunities. It's all about the mitochondrion ultimately. And it's about reactive oxygen species as the pathophysiologic agent of diabetes and its complications. And many, many things alter mitochondrial function. Heavy metals like lead, mercury, cadmium, too much iron in their body, which we'll briefly touch on, and then all the other chemicals, pesticides, herbicides, solvents, plasticizers, PCBs, and even vaccine components. So mitochondria get sick and swell. There's a nice one there, and you're going to see on the next page one that isn't so happy, and these toxic metals and too much calcium influx. So I'm going to tell you, it's not just that the insulin and the sugar is the problem, or the endothelium isn't working right. And even if you deliver the oxygen and the nutrients to the mitochondrion, if too much calcium or toxic metal gets into the mitochondrion, it shuts down their chemistry. And here's one, it's lost its ultrastructure. You can see the difference. The one on the right is a nice one. It's got those little dots, which are its ribosomes. And this one has lost its, and remember, the enzymes that make energy are on these little membranes. So when you lose those, you just don't make energy. That's why you're tired. You have mitochondrial failure. And then you have metals, toxicity and oxidative stress. Again, this is out of standard scientific literature. The unifying factor in determining toxicity and carcinogenicity for all these metals is the generation of reactive oxygen and nitrogen species. Antioxidants, both the ones that we take in and the ones we make, and ones like chelation therapy, provide protection against these metal-mediated free radical attacks. And then there's another toxic metal that you might not think of as toxic, iron. A colleague of mine, Jutta Salonen in Finland, looked at a large number of Finns. They have a lot of heart attacks there. He asked the question, what's most predictive of a heart attack? Is it cholesterol, triglycerides, blood pressure, weight, smoking, ferritin, iron? He found that smoking was most predictive of getting a heart attack. The second one was not cholesterol or blood pressure, it was too much iron. Ferritin iron, once it gets to be 200, doctors don't usually measure this, you should make your doctor measure it. It starts to cause heart attacks in men and women. Finally, we're going to talk about chelation therapy. This is an artist's conception of the molecule that we primarily use to chelate people. The white big atom there is calcium, but I want you to know that this molecule was brought into the medical market in the late 50s, early 60s as the treatment for lead poisoning. Imagine that instead of that white one being calcium, it could be lead. And EDTA is still on the market. It is the standard treatment for lead poisoning. It just so happens that it does other good things, like take out cadmium and whatnot. Now, I'm going to quickly go through this. There's no question about it that lead causes a lot of trouble. It damages that inner lining that we're talking about. It damages your ability to make this relaxation substance called nitric oxide, so your vessels can't open and close. In women, when they go through menopause, their blood pressure goes up. Why? Their skeleton starts to get thinner and leaks out all this lead, which was locked up in their skeleton earlier in life. And it's a calcium antagonist. What does that mean? Well, when I said about calcium leaking into the mitochondrion, when lead is present, the little channels through which calcium goes are opened up 5 times longer than they should be. So as time goes along, more and more calcium accumulates and poisons your mitochondria. It also damages the nervous system. It binds onto receptors and slows down conduction. That's why people with lead poisoning, they tend to be violent, distractible, they have trouble in school, and it changes behavior, as I said. Aged populations at increased risk due to mobilization from bone. It also inhibits immune function. It binds onto myelin in the brain. Actually binds and you start to create antibodies against your own brain tissue. This is rather serious. It's sort of a form of autoimmunity initiated by lead, cadmium, mercury, etc. So they compromise innate immunity. They decrease the number of your white cells that are able to attack cancer and different infections, and even direct causation of cancer. But there's also the multiplicative effect, and that is you get synergy with lead and other metals and other carcinogens. So in toxicology, 1 + 1 + 1, like lead, cadmium, and let's say a farm chemical, doesn't equal 3. It may equal 1 million. Because once you've overwhelmed the body's ability to discharge toxins, you can't get rid of them. You need help. Regarding cancer, I have a colleague in Switzerland, Walter Blumer, that we visited once 25 years ago, and he had a little practice out of his home, and he was using chelation therapy for people with fatigue. He thought maybe the leaded gasoline was causing people headaches and fatigue and whatnot, and indeed they got better. Later on, 18 years later, he compared the people that he chelated with age-matched, sex-matched, economic-matched people in the same town, and what he found is the rate of cancer in the chelated patients was 1/9 of what it was in the non-chelated. Do you think it could have been because of taking out the toxic metals? I don't know what else. Also improving circulation, taking calcium out of the arteries. So we've already talked about these metals have diverse toxicity to every system of our body. And what does EDTA chelation do? It removes these metals. That's what it was designed to do. But it also corrects calcium in the small vessels and reduces free radical damage to DNA and lipid membranes. It makes your platelets less sticky, lowers your lipids, improves the function of that endothelium, partly by correcting magnesium, which is another piece of this metabolic puzzle. We're all short on magnesium. EDTA was discovered in 1933. It was used to bind calcium in the linen industry, both in Germany and here. And then in the 50s, it was experimented with children with lead encephalopathy, something that was a fatal disease 100% of the time. And Dr. Marty Rubin at Georgetown had a little girl with lead poisoning, and they saved her life. And that was the beginning of the use of EDTA chelation therapy. And over time, doctors started using it for adults with lead poisoning, and then lo and behold, they'd say, gee, doc, that chest pain I had went away, or my legs have warmed up, or I can think better. And these doctors, Dr. Clark and others, started publishing articles. And this, actually, it looked like chelation was going to take off, but it happened at the same time that bypass surgery was born, and guess who won? And then in 2003, we thought we had a breakthrough. In Taiwan, a doctor did a study on people with renal failure that were on the road to dialysis, and he split them into 2 groups. One gave them EDTA and one gave them placebo. And guess what? The ones that got chelation didn't have to have dialysis. I thought, oh my God, it's New England Journal of Medicine. This is going to happen, and it just died right out. So then finally, myself and about 70 other doctors around the country and in South America and Canada finally got the government to do a study on chelation therapy, and it was called the Trial to Assess Chelation Therapy. It lasted for 5 years, and then there was some follow-up time, and basically we all chelated 1,700 people, and they were split into ones that got salt water and ones that got EDTA. And there was and these were people that already had 1 heart attack. There was no question that over the 5-year period, the people that got chelation lived longer, had fewer need for bypasses, strokes, or hospitalizations. And when you looked at the diabetics, there was even more dramatic difference. There was no question, and we've known that for 30 years, that diabetics do the best with chelation. They almost immediately start noticing improvements. My colleague Klaus Henke in Denmark, where they have to wait in line for having amputations and bypasses, sometimes months. He had 27 patients that were on the schedule to have amputation of their leg, and they came to him and got chelation. 24 of them saved their leg. If that's all that we could do with chelation, it would be worth doing. And indeed, glycemic control is tied to coronary calcification. So the more our sugar stays high, the more calcium enters our cells, and we get plaqued and et cetera. Now, I knew that chelation worked, but I wanted to prove how. And I had the good fortune of working with a guy at USDA, Richard Anderson, and a group in France, Anne-Marie Roussel, to look at before and after chelation what happened to free radical markers. And we proved that chelation therapy reduces oxidative damage to your own DNA and to your cell membranes. And that may be another way, that is another way why people feel better. And also, I published an article showing that just about everyone was short on magnesium. And when we infuse EDTA into your veins, it's hooked to magnesium. So we're really giving you magnesium EDTA. So the magnesium is turned loose by the EDTA, and the EDTA grabs calcium or lead or cadmium. And so you get a double bonus. You get rid of things you don't want, and you get magnesium built back up in your cells. So it's, and this has been shown that magnesium deficiency is universal in diabetes and prediabetes. And here's finally magnesium deficiency and metabolic syndrome. Stress and inflammation may reflect calcium activation. It gets back to that calcium entry into the cells. So now we're just going to look a little bit at some of the studies that have been done. So this was a man I chelated long ago in Illinois, a diabetic man who was told to have bypass. He owned an Italian restaurant, which was actually the worst of it because he loved his food. And anyway, he didn't want to have a bypass, and we chelated him. And in those days, we do treadmills before and after. And over a period, in this case, he had 70 treatments over a many years period. His EKG treadmill totally resolved. The blood pressure totally came back to normal, and he never did have a bypass. Here's a lady whose cholesterol went from 393 to 165 in a couple months on chelation and diet, and triglycerides 2,600 to 271. She had been following the American Diabetic Association diet. And I took her off that diet, and look what happens. I mean, this is not even hard. Here's a gentleman that came, he didn't even know he had, this hemoglobin A1C is a test for diabetes. It should be, we think, about 5.2 or 3. And it measures, you remember I talked about glycosylation? It measures how much sugar is attached to your hemoglobin. And the lower percent, the better. His was way up at 12.2 with a fasting sugar of 266. Tons of iron in his body. Remember I told you about that? And lots of inflammation. In a few months, he no longer had diabetes. His sugar was down, iron was down, and felt a whole lot better. And here's an angiogram. You could see a little bit of dye coming through the knee area before chelation, and then after a series of these chelations. And even gangrene, and I have treated, we don't see these so often anymore, but I have treated a number of cases that were also on the launching pad for amputation. And you can almost always save them if you catch them early. Now, I can tell you how I got into chelation. When I finished my training, I went to work for a man, and I was disillusioned with medicine at that point already. And I started, my mother actually got me reading Prevention magazine, and I was experimenting with vitamins and minerals, and I was seeing things happen that I would have never learned in medical school. And this doctor that I worked for allowed me to use natural methods. He didn't care what I did, and so it was a really unique opportunity. At any rate, his sister-in-law came in with a book on chelation therapy, and she had been told that she had a little bit of chest pain. They said, well, you need an angiogram and you're going to need a bypass. Actually, she had an angiogram and they scheduled her for a bypass, but she felt pretty good, and she handed me this book by Gary Gordon on chelation therapy. She said, would you read it and let me know what you think? And I did read it, and I thought, this is either total quackery or this is something huge. And I knew enough about chemistry to know there was a rationale for it, in metal binding, that is. And at that time, as chance would have it, my father-in-law, that gentleman, that's my eldest daughter, Sarah, and my middle daughter, Becky, they're not here today. Art came, I was his doctor too, and he had high blood pressure, he smoked heavily. He was having mini strokes where he would go paralyzed on one side. I'd have to put him in the hospital, get his blood pressure down, but it was just a matter of time until he was gonna have a complete stroke and be in a nursing home, and he was only 59. He had a very loud noise, we call him a bruit. When you have a stream that narrows, right, it becomes turbulent, and you can actually hear it, psh, psh, psh. And he had that, and that's what was causing him to get paralyzed. He had no pulses in his feet, he had chest pain, he had bad lungs. At the time, I had sent him to a South American doctor, a neurosurgeon, a very, very wonderful doctor. He just didn't operate unless he thought he could help somebody. And he said, Waters, I'm going to tell you something. You ought to let your father-in-law retire. I'm going to kill him if I operate him. He's just got too much wrong with him. So it happened to be that I had read this book, so I went to my mother-in-law and said, listen, I read this book. I wonder if you guys would be willing to try this. She said, of course. We went to Zion, Illinois, and found a doctor, Dr. Sanchez, who chelated my father-in-law in the summer of '82, 27 treatments, and it was nothing short of a miracle. This noise went away. His foot pulses came back. His angina went away. And Sarah she found this picture recently, and she wanted to, we have another picture. He went to Florida to live with friends after the 27 treatments, and I went down there at Christmas to be with him, and I got on the beach with this guy. I was in my 30s at the time. I could barely keep up with him. So what do you think I did? I came back and started calling up patients that we had given him the sign of the cross. You know, the routine is, you're a GP, someone's got terrible heart disease, you get worried, you send him to the university, the cardiologist looks at him, and if the cardiologist says, you know, nothing else can be done, then you've done your job. So I'm calling people up and saying, you know, that cardiologist and I told you there's nothing to be done, don't believe it, come and see me. And we started chelating people in January of '83 and have never stopped. Art lived 15 more years, and he smoked part of the time. You know, they say down for the third time in the water. Well, I'd get him well, he'd be doing good, and then succumb to the smoke thing, and then down, and then I'd chelate him again. But, you know, he still lasted till 75. And I love this quote, and until you're sick, you don't really know this. This is 300 BC, Herophilus. When health is absent, wisdom cannot reveal itself, art cannot manifest, strength cannot fight, wealth becomes useless, and intelligence cannot be applied. And finally, our 9-pronged program in our office, we start out with a low carb, and in some cases a ketogenic diet, in some cases removing certain lectin-containing foods. We help you start some type of movement, be it a trampoline or walking, something. Every little bit helps. We help you with nutritional deficiencies. We measure what minerals and fatty acids you have in your system and what you need. We use botanical substances to dampen inflammation, like we mentioned earlier with berberine and all these. We balance the endocrine glands. So many people, by the time they're sick for a long time, have thyroid trouble, adrenal gland trouble, sex glands are not functioning anymore. Helping people with sleep. We've learned a lot about sleep. I've learned it in my own case by going to a dentist and having a sleep study that revealed I had sleep apnea. I snored like heck, and this dentist made me a device that I put in at night, and I immediately quit snoring, and I sleep through the night. I would encourage anybody, rather than just submitting to a CPAP, find a dentist that will take seriously the airway problem, because that will ruin your sleep and it will ruin your metabolism. That could make you pre-diabetic. Address other lifestyle problems. We also look into, do you have mold in your home? What kind of chemical exposures you might have? Detoxification, that's the first part of detoxification, using sauna. Sauna will remove all of these chemicals that you think of, dry cleaning fluids, plasticizers. Amazing stuff comes out of people. Some of my colleagues have actually put little patches on people so after they sweat it in a sauna, you can analyze what comes out of the human body. Sweat is part of your detox system. And finally, what we talked about here, EDTA chelation therapy, which addresses all of the different underlying components of the disease of toxic metals, of calcium accumulation, of free radical attack of your membranes, of your proteins, and of your very DNA. Thank you.